Good morning. I am Dr. Krishnaveni Sharath, Associate Professor in the Department of Anatomy, Sree Balaji Medical College. Today we are going to learn the introduction to cardiovascular system. You would have heard many cases where there are blindness in a patient with diabetes or a kidney failure in a patient with diabetes, and you would have wondered why it happens only in certain organs and not in all. The answer lies in the type of arteries which are supplying the eyes and the kidney. How do we know them? We should know the introduction to the cardiovascular system, and we should know the type of arteries that are present in our body. The objectives of this session are: we should be able to define the blood vessels and describe the layers of blood vessels. We should be able to classify the structure and function of blood vessel. We should be able to define the artery, arteriole, capillary, vein and venule, enumerate the difference between artery and vein, and describe the various types of circulation, that is systemic, pulmonary, portal and fetal circulation. The blood vascular system is mainly made up of the pumping organ, that is the heart, which pumps the blood and through the blood vessels. The blood contains plasma, RBCs, WBCs and platelets. Blood vessels, the types are mainly the arteries, arterioles, capillaries, sinusoids and veins and venules. Coming to the structure of the heart, this is the external features of the heart, and here you can see the internal feature, a schematic diagram showing the 4-chambered heart, that is the right atrium, right ventricle, left atrium and left ventricle. Let us know about the types of circulation. We have systemic circulation. Systemic circulation means the heart receives the blood through the superior and inferior vena cava to the right atrium. From there it is coming to the right ventricle, which goes to the pulmonary artery, that is pulmonary circulation. And from the pulmonary vein, this comes to the left atrium, from left atrium it is coming to the left ventricle, and it is circulated throughout the body via the aorta. This is known as the systemic circulation. Pulmonary circulation, from the right ventricle, it is going to both the lungs via the pulmonary artery. It is getting oxygenated and then comes back to the left atrium via the pulmonary veins. Coming to the portal circulation, this is a special type of circulation where blood has to pass via 2 sets of capillaries before draining to the systemic vein. Otherwise, it will pass only via 1 set of capillary. The portal circulation examples in our body are hepatic portal circulation, renal and hypothalamo-hypophyseal portal circulation. Fetal circulation is different. Here the fetus receives the blood through the umbilical artery from the mother, and there are suitable changes in the fetal heart so that the oxygenation is received well by the fetus. It will be studied in detail in embryology. What is a blood vessel? Blood vessel is a tubular structure which is carrying blood to and fro from the heart. We can classify it according to 2 types, that is anatomical classification and functional classification. In anatomical classification, we have elastic artery, muscular artery, arteriole, capillary or sinusoid, venule and veins. In the functional classification, it can be classified as the conducting vessels, distributing vessels, resistance vessels, exchange vessels, and capacitance or reservoir vessels. Here we are seeing the various types of blood vessels. We can see the vena cava, the large vein, the venule, capillary, arteriole, muscular artery, and the elastic artery. Coming to the arteries, arteries carry blood away from the heart for distribution to different parts of the body. Large artery is greater than 1.1 centimeter in diameter. Medium-sized arteries are 1 to 10 millimeter in diameter. The arterioles are minute branches of the arteries that are just visible to the naked eye, about 0.5 millimeter in diameter. And capillaries are microscopic vessels that connect the arterioles and the venules. These are in intimate connective tissue for nutrients and metabolites. Coming to the structure, the blood vessel is made up of the inner layer tunica intima, middle layer tunica media, and outer layer tunica adventitia. Tunica intima is made up of simple squamous epithelium. So here we can see from inside to outside how the layers are arranged. There is tunica intima, then there is tunica media, and then there is tunica adventitia. This is the anatomical classification of the arteries. We can see elastic artery or the large sized artery, where the tunica media is mainly made up of elastic fibers. Then the medium sized arteries or the muscular arteries, in this the middle layer, that is the tunica media, is mainly made up of smooth muscles. Coming to the structure of the vein, veins will have a valve. The histological structure will remain the same. There will be tunica intima inside, tunica media in middle, and tunica adventitia in the outside. Tunica adventitia here will be the thickest layer. The veins adjoining the capillaries are very small and they will be called as the venules. These carry blood from different parts of the body and they will bring it to the heart. These veins are formed by union of venules and they will be called as the tributaries of the veins. Venules, the size will be about 0.5 to 1 micron in diameter. Medium-sized veins will be of 1 to 10 millimeter diameter and large veins will be greater than 1 centimeter in diameter. The examples being superior and inferior vena cava. The veins have to bring back the blood from various parts of the body to the heart. In the lower limb or in the leg, they have to overcome the gravity to bring the blood back. So the factors helping venous return, it is important to know, that is the capillary overflow, which is termed as vasa tergo, the negative intrathoracic pressure due to the breathing. In the upper part, it is simple due to the gravity. Muscular compressions in the lower part, lower limb, that is why the calf muscles are also known as the peripheral heart. The venous valves which are present, they will prevent the backflow. And for the venae committents are the veins which are accompanying the arteries. The arterial pulsation will help in the venous return. Here we have the histological structure of the large vein and the medium-sized vein. There is tunica intima, tunica media and tunica adventitia in both. Coming to sinusoids and cavernous tissues. In certain organs like liver and spleen, the capillaries are replaced by sinusoid. They are also seen in organs like penis and clitoris. Venae committents are the pair of veins which are accompanying the artery. Let us know some of the differences between the arteries and veins. Arteries arise from the heart and carry the blood away. They are thick-walled. They do not have valves. Tunica media is the thickest and the lumen is small. The veins bring blood back to the heart. They are thin-walled and superficial. They have valves. Here tunica advantagea is the thickest and lumen is spacious. This diagram shows the histological difference of the arteries and veins. Coming to the capillaries, capillaries are network of microscopic vessels connecting the arterioles with venules. There are three types, that is the continuous, fenestrated and sinusoidal. In continuous type of capillaries, there is uninterrupted lining of the endothelial cells. The location, most common location is the skin and the muscles. Fenestrated capillaries, some endothelial cells will have pores. The examples will be in intestine and kidney. Sinusoidal, here modified and leaky with large fenestrations. This is seen in liver and bone marrow. Let us know what do we mean by anastomosis. Connection of two tubular structures. It can be of any two tubes, artery, vein, even the intestine, it will be known as anastomosis, so that they become continuous. Here we are concerned only about the anastomosis in the blood vessels. We have three types, that is arteriovenous anastomosis, venous anastomosis and arterial anastomosis. Arteriovenous anastomosis is seen in finger, toes, ears, etc., where it helps to maintain the body temperature during cold weathers. It prevents the loss of heat. Venous anastomosis, there is alternate drainage of the organs seen in the palm or in the sole. Arterial anastomosis is also known as collateral circulation, helps to maintain the oxygenation of the organs. End arteries. I introduced the subject by talking about end arteries. We have anatomic end arteries and functional end arteries. Anatomic end arteries, the name clearly says, the vessels whose terminal branches do not anastomose with branches supplying the adjacent area. The best example is the end artery of retina. The arteries of spleen, liver, kidney and even the metaphysis of long bones act as anatomic end arteries. Functional end arteries, the terminal arteries are anastomosing with those of adjacent arteries, but it is insufficient to keep the tissue alive if the artery is occluded. For this, the example are the central arteries of cerebral cortex. That is why in cases of stroke, we see functional damage of the whole area. Coronary arteries. In case of coronary arteries, there can be bilateral collateral circulation which can happen. So that is why in cases of myocardial infarction of the older people, the chances of death is less. But whereas the chance of death is more when the MI occurs in young because there is no collateral circulation. Vasa vasorum. Vasa vasorum is the blood vessel supplying the blood vessel. So it is seen mainly in the tunica media and sometimes in the tunica advantagea as well. Coming to some of the applied anatomy, you would have heard about thrombosis when the blood clots and blocks the vessels. Most commonly deep vein thrombosis, coronary artery occlusion and all we would have heard. Embolism is when this blood clot, it will dislodge and it becomes an emboli. If it goes and gets stuck in small arteries like that of the pulmonary arteries, we will see what is called as pulmonary embolism. Also, cerebral embolism is seen. Hemorrhage, obvious result of rupture of blood vessels which results in the loss of blood to that area of distribution. Some of the other applied anatomy of the cardiovascular system are aneurysm, where the blood vessel is thinned in a part and it will enlarge like a balloon. Varicose vein, it is seen mainly in the lower limb where the veins are dilated and they become incompetent to carry the blood. Berger's disease is a rare disease which is seen in smokers who are young. Here the arteries are occluded. It will lead to severe pain and there will be ulcers as well. This might need amputation of the fingers or toes. Atherosclerosis, it is the most common cause for MI. Here plaque is deposited in the blood vessel. It will lead to the thrombus. Thank you. So, by knowing the applied anatomy of the vascular system, we will be able to provide a better patient care to our patients. The important questions from this topic will be end arteries, sinusoids and anastomosis. That's all for today. Thank you.